wellness revolution starts now.
Welcome to the program. My name is Bryana Gregory, Pharmacist and Physician Liaison with Physicians Preference Pharmacy. Today, we are going to discuss one of my very favorite topics, which is that of methylated B vitamins. And I know that that sounds like a mouthful, so we're going to unpack the whole thing. But I want you to listen up. If you feel like you're exhausted, but your labs show up normal, or maybe you take B vitamins, but you just don't really actually feel the benefits, then you're going to want to tune in throughout this entire episode because I'm about to break it down for you. So we're going to discuss and unpack a few key points surrounding the topic of B vitamins. Especially, we're going to talk about the dosage form. So whether you're taking it in capsules or sublingual tablets, that's going to make a difference. Whether you're taking it in oral capsules or sublingual tablets, that's going to make a difference. Also, who they're for. Are they for everybody? Do you need it? Do you not need it? How do you know? That's what we're going to discuss. So first of all, let's lay the groundwork for what B vitamins are and why they are crucial and essential to normal bodily function. We are always talking about how we get to a place in our health where we can thrive and not just survive. And I would absolutely put the use of B vitamins in this category because we most specifically relate them to energy production and maintenance of energy so that you feel like you are vivacious and you have vitality, you have pep in your step. So most importantly, we always talk about B vitamins and their role in energy production. Also, we cannot forget about the brain and the nervous system. Just like any type of medication or supplement that we use, or even if we're talking about hormone replacement, we are always after homeostasis or balance in the body. Never is it good to just keep giving more and more and more doses, and sometimes the dose is too low. So this is why we're trying to find a customized dose for you. And what I mean when I'm talking about brain and nervous system is sometimes people will come to us and they say, well, I have neuropathy, or I have burning, or I have numbness, or I have tingling. A lot of times that is related to the nervous system. But what I want you to hear here is that the balance of B vitamins in the body is absolutely crucial for not only allowing the nervous system to work appropriately, but to manage symptoms. So sometimes if you take too many B vitamins or the wrong type of B vitamins, you can actually have nerve pain or neuropathy or tingling or burning sensations. At the same time, if you are too low in said B vitamins, you can have the same symptoms. So that's why I want to guide you today on bringing in the most appropriate type of dosing for you, but especially the right form. So as a compounding pharmacist, we are always looking at optimizing the dosage form, which is another fancy way of saying how we get it in the body, especially. Also, B vitamins are very important for mood and the stress response. Also, red blood cell formation. So B vitamins is something that it can be measured, and we can see if we're on track for how we're dosing. But many times we go off of symptom improvement, or again, do you feel like your energy is being optimized? And then one that I simply cannot skip over is detoxification. So when we talk about B vitamins, there's a lot of different sources that you can get them from. Now we're going to talk about the difference between the B vitamins that your body makes and methylated B vitamins. So you can get B vitamins from your food. You can get it from supplementation. Also, your body makes some. So in the GI bacteria and the gut bacteria in your body, those bacteria synthesize or make low levels of B vitamins, but not very much is actually absorbed. So we have to look at all the different sources for B vitamins and be sure that the absorption is maximized. So when I talk about detoxification, what you need to understand is that whether you're getting B vitamins through foods or vitamin and mineral supplementation, your body uses that in a specific way. So you versus me, our bodies are going to utilize that in a different way. And there are a lot of things that impact that, genetics being one of them. Also lifestyle choices. But when we look at the topic of toxicity, we have to understand that B vitamins are crucial for detoxification. However, if you're not getting the right form of B vitamins, your body can't utilize it to detoxify. So when you sit down to a B vitamin rich meal, your body is going to break it down It's going to utilize B6, B9, B12. It's going to convert it into antioxidants. It is going to convert it into homocysteine, which has an effect on the cardiovascular system. It is going to eventually convert it into glutathione. Glutathione is your body's master antioxidant. So I paint this picture for you, not to go into the full methylation process because it's very complex, methylation being the breakdown of B vitamins, but to just illustrate the point for you that what you eat and the form of B vitamins that you take is absolutely crucial to whether or not your body can ultimately detoxify or pull toxins out of the body and eliminate it in the form of waste. So that's cellular detoxification and removing it in the form of waste. We detoxify through sweat, through urine, and through feces primarily. So we have to be doing all of those things regularly to appropriately detoxify. Now, when we talk about methylated B vitamins, what that means is that these B vitamins are in a form that have already been broken down for you so that your body doesn't have to do the work. Now, there is some methylation that's happening or breakdown that's happening naturally, but if your body is not set up to break those down appropriately, then B vitamins can actually build up in the body in a toxic form if you don't take the right form, which is the point I really want to drive home. So when we talk about methylated Bs, it's a big word, but just think of it as the active form. It's the more bioavailable form. It's the form that your body can absorb and utilize better. We're not trying to fight an uphill battle here. Now, like I said, B vitamins get converted to homocysteine, to methionine, and ultimately to glutathione. So very important for the detoxification process. Additionally, we live in a very toxic environment, especially if you're in inner city, but even if you're not, you're still exposed through microplastics, through stress, through inflammation, through the food supply, through the water supply. So whenever I get the argument, well, why do I need to take vitamins? We are living in a toxic environment. So first of all, we have to try and counterbalance that before we can even consider optimizing our bodies. All right, so let's talk about the key players of B vitamins. Usually we're talking about B6, B9, and B12. So B6 is one that probably goes less talked about, but you want to be sure you're getting the most bioavailable or methylated form. So that's pyridoxal 5-phosphate. Also, we're talking about B12. For example, this might be methylcobalamin. And then folate, which is vitamin B9, often abbreviated as 5-MTHF. And we're going to unpack what MTHF is because a lot of times we hear about MTHFR. All right. So we talked about what B vitamins are. Let's talk about why some vitamin B deficiencies are common in the first place. We talked about toxic environments. So we have to take into consideration both lifestyle and genetics, stress, poor absorption. One of the main reasons in the compounding pharmacy why we will change with the doctor's order, change the dosage form from, let's say, an oral capsule to a sublingual tablet, or an oral capsule to a cream, or an oral capsule to an injection, is we tweak that dose to make it appropriate for the person taking the medication. But if their gut terrain, their microbiome, and their GI absorption is not good, you're basically peeing or pooping out what you have just taken in. It is a waste of money. This is why we want to optimize it for you. So if we give you an oral medication, we want to be sure that your gut health is on point so that you can absorb and get the most bang for your buck out of that medication or supplement. So poor absorption is definitely a consideration. Many people have very poor gut absorption, actually. Of course, we want to fix that, but additionally, we need to be sure you're getting the right type of B vitamins in you. GI issues were covered. Something I also need to talk about as a pharmacist is medications. So something that oftentimes goes overlooked is what we refer to as drug-induced nutrient depletions. It's actually quite simple. You are prescribed a medication that is usually a Band-Aid fix or a quick fix, and then it causes a second set of symptoms in comparison to what you were experiencing the first time. So you go into the doctor, you have said symptoms. They prescribe you a medication, it causes other symptoms, then another drug for those symptoms. Once you start tacking on these drugs, what happens is each of those drugs has some sort of role in the body. A lot of times that role will also, as a side effect, utilize some of the body's essential nutrients to do its job. So I'll give you a few examples that I see most commonly. First would be proton pump inhibitors, which we refer to as PPIs. Those would be, for example, your omeprazole. Unfortunately, these drugs are indicated to only be taken for about 2 weeks. I have met many people throughout my career as a pharmacist who are on these medications for 40 plus years. What it does is it alters the pH of the stomach, meaning that it calms down that gastric reflux or that burning sensation. But when it does that, it messes with the stomach acid. The stomach acid is hydrochloric acid that is intended to be there. God put it there to break down our food. So once we start messing with that, we are also messing with the overall nutrient absorption. Also, oral contraceptives. So something that we talk about a lot. We're not generally a fan of these because we know the synthetic progestins and the negative effects that they have on the body. But additionally, oral contraceptive use or birth control, the oral birth control pill, is generally associated with low vitamin B levels as well. Diuretics. Example would be furosemide, which increases the urinary excretion of nutrients, including B vitamins sometimes. Diabetic medications. So metformin, reducing B12 absorption in the latter part of the GI tract, which is where a lot of drug absorption happens. Also, sort of a debated one, but I think it's worth bringing up, is people who follow a strict vegetarian diet. So B12, for example, is found in a lot of places. Where we generally find a lot of nutrients are in the soil. In fact, that's where a lot of our medications are actually originally derived because of the bacteria that lives in the soil. Now, that's not the problem. The problem in quotes, is that we wash our vegetables. Obviously, we don't want to be eating that dirt. So we're washing away a lot of that natural source of B12 that we would typically get in animal products or milks, for example, because the stomachs of those species that we consume those animal products from, they hang on to those sources of B vitamins differently, which allows them to be ingested into us and retain that B vitamin source. And then also the effects of genetic variations. So we always talk about MTHFR. That's probably the most famous genetic variation. A lot of times people will say, I have the MTHFR gene. Okay, well, everybody has the MTHFR gene. What they're really referring to is that they have a genetic variation at that gene called MTHFR. MTHFR is not the only player in methylation or B vitamin breakdown. It's just that it holds the most weight, meaning that if there is a variation or a change in how that particular gene is functioning, then it has a much broader implication on lowering the overall B vitamin absorption. So what we want to do is we want to be sure that all of those genes are optimized. You're born with said genetic code, and we cannot change that. However, what we can do is be sure that you get the right types of vitamins so that they turn on that switch or tamper down the function of any said gene. Because again, we're always after homeostasis. We're always after balance. That's when your body is in its happy place and will be much less likely to develop inflammation or chronic disease. So when we talk about methylation, again, it's a bit like a light switch. So when you think about walking into a room, you flick on the light. That's like methylation. And that's how genes work, exactly. So we want to be sure that the genes that are supposed to be turned on at any given time are, or turned off at any given time are. Just one very common example that we all understand is cancer. When some of these signals are constantly turned on instead of turned off, we get excess growth of cells, blood supply, and we don't want that. So that's why we want to be sure that our genetic function is in check. Also, something to be very aware of when we're talking about the form of B vitamin that you're getting is synthetic forms like cyanocobalamin or folic acid. Folic acid is probably one of the biggest scams because it's put in basically every prenatal, but it is a synthetic form of B vitamins that is supposed to help with neural tube formation. However, let's say that the mom that takes that prenatal vitamin cannot absorb, break down, methylate that B vitamin and utilize it. If her body can't utilize it for formation of a healthy baby, then what happens? It builds up as a toxic substance. So now we have a separate problem. When we talk about fortified cereals, which hopefully a lot of this will be changing, but when we talk about fortified cereals and packaged foods, children's packaged foods, all of this stuff that's being marketed to kids is usually packed with folic acid. It has what? An image of a heart on it. It's heart healthy. It's got B vitamins in it. Okay. But when most of the world's population has genetic changes that do not allow them to break down B vitamins, that synthetic form of folic acid will build up in a toxic way. And it will present itself as poor performance in school, focus, concentration issues, and then what happens? Boom, ADD, ADHD diagnosis. But was that really the issue? Maybe, maybe not. It deserves further questioning for sure. So why does methylation matter, or the methylated forms of B vitamins actually matter? So again, they're already in their active form. It's easier for your body to absorb and utilize, and it's especially helpful for those people that have genetic variants like MTHFR or some of the other ones that can also be tested. And then when we talk about what B vitamins are good for, we should also talk about how to identify some of the common symptoms of someone that has poor methylation. So I just alluded to a few, especially in our population of kiddos: poor focus, poor concentration, fatigue, brain fog, mood changes. Headaches are a really big one. So uncontrolled headaches, especially when they don't fall in specific patterns or certain times a day, may be methylation or poor methylation related. Those symptoms can be assisted or improved with B vitamin supplementation. And then I talked about the trouble focusing in the kids as well. So let's talk about dosage form. So when we talk about our proprietary compounded product, we are talking about a sublingual dosage form of vitamin B, a methylated vitamin B product. Now, one of the biggest mistakes that I see people make when they choose a B vitamin, because it's usually one of the first vitamins people buy, probably B, C, or D, is they go to the closest drugstore and they grab the first, or usually the cheapest, B vitamin that they can find. It's not always going to be about cost, but what it is about is, are you getting your money's worth? And that's where the value comes from. So are you taking an oral capsule? Are you taking a lozenge? Are you taking a sublingual tablet? Some people go into the doctor's office for injection, right? There's all of these different options. So when we talk about dosage form, we're talking about, is it the injection? Is it sublingual? Is it oral capsule? And which one is right for you? Talking about sublingual, that's something that dissolves underneath the tongue. And we love the real estate underneath the tongue because it's so valuable for increased absorption of medications and supplements. One of the other benefits about using a sublingual dosage form is we can lower the dose. So when you take something through oral capsule form, it has a long journey to go before it makes it into your bloodstream. That's what we call first pass metabolism. So you swallow a capsule, it goes down your throat, through your stomach, into the GI tract, into intestinal blood flow to the liver. It gets metabolized, which is where the metabolism of most supplements and medications happens. And then it spits it out into the bloodstream, so into systemic circulation. So all that I just explained can be circumvented or bypassed with sublingual delivery. So I brought my own prescription here. You take one of the sublingual tablets and place it underneath the tongue. And when you do that, you are getting really good contact with the large vessels located underneath the tongue. And that is a direct gateway to the bloodstream, to systemic circulation. So because we don't have to go through the stomach, the intestine, the liver, and that first pass process, we can give lower doses because it's going straight into the bloodstream. And look how small that little tablet is. And so I take 2 of these every single morning. Some other people that can really benefit from the use of sublingual but also methylated B vitamins are those people with GI issues, also with low stomach acid, if they can't break down the oral formulations, absorption challenges, chronic fatigue, neurological symptoms, this is an extremely easy dosage form to use. It doesn't require dexterity, like trying to spray or inject anything, and you just place it underneath the tongue. It also can be really good for those that have behavioral issues, neurologic issues, older adults or seniors, people that are post-bariatric surgery as well. And those are just a few options. So let's go ahead and talk about why the compounded product of methyl B, as we call it, is so crucial for many. So again, we customize this at the compounding pharmacy. It is by prescription only. And generally, we are always using less binders or fillers because we don't have to coat it. It's not going through the stomach. Again, it's going directly right into the bloodstream. Now, some of the advantages of this methyl B product is that it's got the high quality active ingredients, and of course, they are already methylated or broken down for you. And let's just remember, one size fits all should not even be a conversation around here. So the person that can go get something off the shelf at their corner store might have different requirements than the person coming in to get a prescription. The only reason it's by prescription, even though it's a vitamin, is it's made at a compounding pharmacy. So legally, we have to require a prescription for that. So who is methyl B for? Let's go ahead and wrap this up and talk about some ideal candidates, and maybe you think that you might be a candidate or fit into some of this list of symptoms. So fatigue, low energy, probably the number one reason why people take B vitamins. Brain fog, poor focus, mood fluctuations, high stress or burnout. Who's not going to fit in that category, right? Known B12 or folate deficiency. So maybe you already know that, or perhaps you have genetic variations telling you that you need to have a specific form of B vitamins for the most important and effective absorption. Neuropathy, so some of those nerve issues like nerve pain, tingling sensation, burning in the bottom of the feet. And also those that do not, let's think about this on the flip side, those that do not have genetic variations may not have the need for methylated B vitamins, right? So we're always trying to tailor the medication or the supplement to the patient. So ask these questions. This is why you have to have a physician that understands it's got to be personalized for you and can provide this guidance. And as I mentioned, it's by prescription only, so they will need to write that. So what to expect when you start something like methylated B vitamins? Well, of course, we want that improved energy, focus. We want the alleviation of brain fog, which a lot of times will come alongside for those that have thyroid dysregulation. So brain fog is something that we really see a lot of. So you should expect lifting of that brain fog, mental clarity, better mood. But what's the timeline for this? So if you start taking this prescription today, some people start actually noticing some of those benefits right away. Again, it's very fast acting. It goes directly into the bloodstream. Additionally, some people are pretty bad off when they get started on it. So it might take them a few weeks to really start to see a lot of these benefits kicking in. So the timeline for healing is going to be different for every single person that we talk to. Okay, so key takeaways here, and what I want you to understand as we wrap up is that methylation matters. Methylation is just a fancy way of saying turn on the light switch. And so when we do that, we are getting the appropriate breakdown and absorption of B vitamins into the body so that it can translate that into energy and sustained moods and vitality. Sublingual dosage forms, very important for being able to lower the dose, using less of the active drug and pushing it into the places in the tissues where it actually belongs. So what I encourage you to do, next steps, talk to your prescriber about this. Ask them about methylated B vitamins if they think that you are a good candidate for it. And of course, as always, if you have any questions for us, any of our pharmacists or myself at Physicians Preference Pharmacy, please pick up the phone, give us a call. Our phone number is 281-828-9088, and it would certainly be our privilege to serve you. At Physicians Preference Pharmacy, we believe that personalized medical treatment and customized medications are the best way to help you achieve your healthcare goals. Sometimes this requires adjusting the dosage form of the medication from something like an oral capsule to a tablet which dissolves underneath the tongue. This is called a sublingual tablet. Sub meaning under, lingual meaning tongue, under the tongue. And there are several reasons why your doctor may want your medications to be custom made into a sublingual tablet.
Perhaps you have trouble swallowing capsules or difficulty absorbing medications. With sublingual tablets, you still get the treatment you need in a way that is effective for you. Tablets made here at Physician's Preference Pharmacy are designed to dissolve fully under the tongue in just a few minutes and offer an additional option for you to achieve your healthcare goals.
Information provided on this program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this program is at the listener's discretion.